Thrive is a citywide movement of Londoners all working together in a coherent, collective, co-productive, collaborative way in order to improve the mental health and well-being of all Londoners across all ages.
Around 1 in every 4 Londoners will experience mental health problems during their lives. That's why we've launched Thrive London.
Thrive started by holding a series of workshops, task and finish groups to look at working together collaboratively to identify what are the priorities for London. A lot of the ideas, a lot of the solutions, a lot of the real identification of what the real problems are emerge from the communities, because those are the ones that are living the lives that are most stressed. We have pulled together already about 250 partners that are committed to this agenda around improving employees and employers' health, around improving the health of children and young people and making sure that they've got all kind of different opportunities to thrive. The leadership that the Mayor of London has offered in this regard in terms of supporting Thrive London, of driving forward the campaign, has been so beneficial. The beauty of Thrive is we have power when we are united in numbers, and I think it's that leads to thriving communities, thriving societies, thriving neighbourhoods, and we want to do that together. How do we empower communities much more early on to get the support that they need earlier so that it doesn't escalate into crises? I don't want one other person ending up at the crisis end when actually so much earlier some support could have taken place that would have led to less likelihood of suicide, for example, less likelihood of a lifetime of being on medication. Because if we do start as early as possible, actually what we're creating is thriving children, thriving young people in education, in careers, in apprenticeships, people who believe that there are possibilities, that there are hopes in their lives. One of the areas that I'm really excited about is having Thrive London champions, leaders in every borough, to reach those people who are more at risk of poor mental health. We need to be able to work across diversities, across inequalities, to support in order to then really tackle some of the serious challenges that our societies have. We have higher levels of mental health distress in certain communities. So if you're having that kind of experience of multiple disadvantages and multiple discriminations, then you are more at risk of the vulnerabilities around poor mental health. Therefore, more vulnerable to suicide, for example, or more vulnerable to psychosis, for example. We're wanting a thriving London because so many parts of our city is actually not surviving, is actually struggling, is actually really under a lot of pressure and being cut out of opportunities to thrive. But how can we have a city where some are like really okay and others are not okay? That's what our campaign is really about. Are we okay, London? Are you okay with some thriving and others not? If you're not, come and join us.
I want to let Londoners know how they can show their support. I hope that you can get involved and help us to end the stigma.